The following segment is sponsored by Providence Health and Services. This segment of AM Northwest is brought to you by Family Matters.
Health and education, safety, and the quality of life. KATU and our partners are proud to bring you Family Matters, offering solutions to the hard questions.
Because KATU and Providence Health and Services know that family matters.
You know, February marks American Heart Month. Here to share how lifestyle choices can impact a woman's chances of developing heart disease, we welcome from Providence Heart Institute, Medical Director of Women's Heart Wellness, cardiologist Lori Tam. Good to have you back again, Doctor.
Thank you.
So let's talk. It's the leading cause of death among women.
It is.
Tell me more.
Yeah, it's a staggering number, actually. Yeah. You know, over 60 million women live with some form of heart disease, and 1 in 3 women will die from cardiovascular disease.
So how did we end up in this spot? What are we doing wrong?
Well, you know, there's a lot of things that change, I think, over the course of a lifespan,
sure.
And menopause is one of those. But there's also things that put women at risk and actually notify us earlier before we're aware of it. For example, we know that pregnancy-related conditions such as gestational hypertension, gestational diabetes, preeclampsia, preterm labor, all of those things increase the woman's risk for cardiovascular disease by over 2 times later in her life.
Oh, wow.
So it actually really gives us an opportunity for intervention much earlier because you identify this group that's at risk decades before their event. There's so much we can do in terms of education and empowerment in these women.
When women come into you, and how do you see them? How can you tell they're having heart issues?
Well, it depends. There's certain symptoms that you want to ask about. For example, significant chest tightness or discomfort, shortness of breath, especially with exertion. We know that heart attacks present, and the predominant symptoms is some sort of chest pain or discomfort. But sometimes symptoms are a bit atypical in women. You know, they may not recognize those as symptoms of heart disease. For example, they might have tightness and pressure. They may have sweatiness and shortness of breath. They may not really recognize that their jaw pain, arm pain, shoulder pain is actually a manifestation of heart disease.
Oh, wow. Okay, and then you touched on menopause, but how can that play a role in the development of heart disease?
So we know that with menopause, there are certain things that happen in a woman's kind of physiologic system.
Right.
For example, her LDL, which is the bad cholesterol, goes up. The good cholesterol, the HDL, goes down. She has more insulin resistance and a higher risk of diabetes. There's more development of abdominal fat. All of those things really accelerate your risk of atherosclerosis progressing.
And also hormone replacement therapy. What do you think about that? And will that help?
That's an interesting topic. So we now know that hormone replacement therapy has different risks and benefits at different stages of a woman's life. For example, there is some potential benefit in younger women, but in older women, especially after age 65, hormone replacement therapy can increase your risk of blood clots, strokes, and heart attacks.
Right.
So in younger women who sometimes undergo hysterectomies with their ovaries removed, it may be protective to have them on some hormone replacement therapy until they reach natural age of menopause, which would be about 51 in this country. But in general, we're not recommending starting hormone replacement therapy for the sole purpose of cardiovascular protection alone. But in certain younger women who are having vasomotor symptoms from perimenopause, like hot flashes, vaginal dryness, it's reasonable to treat them with hormone replacement therapy, especially if they're younger than 60 years old and within 10 years of natural menopause.
Okay, let's talk about AFib. Explain what that is.
Well, atrial fibrillation is actually one of the most common causes of stroke in this country. It's an irregular heart rhythm where there is blood pooling. When blood doesn't move very well, it clots, and you can form clots in the heart. Those clots can go to the brain and cause stroke. So it's really important to be on appropriate blood thinners when you have atrial fibrillation.
Okay, and then how would you suggest we handle things when it comes to our lifestyle?
Yeah.
Because that has to be a contributor, right?
For sure. Yeah, so we know that heart disease is preventable about 80% of the time through lifestyle kind of choices. So eating a healthy diet, exercising, controlling blood pressure and cholesterol, and avoiding smoking.
Okay. You have an event coming up Tuesday, February 6th. Tell me a little bit about that.
We do. We're hosting our annual Women's Wellness Workshop. It's a free community event offered to everyone in the community. It's going to be we're going to have a lot of our cardiac heart health experts in women in cardiology who'll be joining us for that. It's going to be in person at Providence St. Vincent, or also available virtually as well. You can get more information. It's Tuesday, February 6th from 6 to 7:30 p.m. And you can get more information at www.welcometobasecamp.org.
Yeah, I do want to ask you, have you had a patient come in and you can see that she's headed for heart disease, you can see it happening, and she's turned her life around?
Yes, absolutely, all the time. And I think that's the beauty of empowering women with knowledge.
Right.
And giving them the knowledge and the tools to live a heart-healthy life. Many times they can do it.
That's fantastic.
Yeah.
Thank you so much. We'll put all that information that we were just talking about on our website, and for more information about the how life experience impacts heart health, we'll put that on our website as well. The number 503-216-0880. Thank you so much, Doctor.
Thank you.
All right, we'll be right back with more AM Northwest. Don't go away.